Well, let's go ahead and get started. Thanks everyone for joining. This is an info session titled Selling High Protein Plant-Based Products into Hospital Markets in Oregon and Washington. We have an incredible group of folks here today. We have growers, value-added producers, food hubs, and nonprofit organizations, and really excited about the diversity of folks here joining. Before we get going, I thought I would just go over a couple of housekeeping items, and hopefully by now we're all Zoom experts, but since we aren't using the Zoom webinar function, I just wanted to point out that you all have the power to mute and unmute yourself and turn your video on and off. So please just remain muted during the presentation, and when we get to the Q&A portion, if you have a question, feel free to raise your hand or unmute yourself and ask the question directly. If you could take a moment to rename yourself to your first name and your organization, that would be great. And as we move through the presentation today, feel free to put any questions that you have into the chat box. We'll try and answer them via chat as we go, or we'll make space for them in the Q&A session. We are going to be recording this session and we'll be sharing it out with all of the registered participants. And if you haven't done so already, please put your name, your organization, and your location in the chat box. All right, so here's an agenda for our session today. We're going to do some really quick introductions, talk for a couple minutes about the Plant Forward Future project, and then we're going to dive deeper into the ins and outs of selling into hospital markets. And then we'll talk a little more specifically about the Plant Forward Futures project and how you can get involved. So my name is Maya Hardy, and I'm the Director of Community Food Systems at Ecotrust. Ecotrust is a nonprofit organization that's based in Portland, Oregon, but we work across Oregon, Washington, Northern California, and Alaska. And we work in natural resource sectors, food and agriculture, forestry, and fisheries. And we work at the intersection of social and racial equity, the economy, and the environment. And my work and my role in this project is going to be to support our producers and delivering technical assistance to producers and really helping them build relationships and connections to hospital markets. So I will pass it to Jolie.
Good morning, everyone. My name is Jolima Rivera Vasquez. I am the Food and Farms Coordinator at Ecotrust, and I will be supporting Maya in this project in providing technical assistance and being more of the coordinating side of things. Today, my role is going to be TA, and so if you have any questions or any problems, just shoot them my way. And I'll pass it to Amber.
Thanks. My name is Amber Hansen. I'm the Regional Program Manager for the Healthy Food and Healthcare Program here in the Pacific Northwest. And I work for an organization called Healthcare Without Harm. I'll give a little background later on, but in general, I support hospitals to purchase more local sustainable food. And so my role in this project is to build and support the hospital cohort that will be connecting to the producer cohort. And that's a great lead into the next slide. I'm going to give a little background on Healthcare Without Harm for those that aren't familiar. And I think it really helps to understand how we came to this project and came to a focus on plant forward proteins more specifically. So Healthcare Without Harm is a nonprofit organization that was founded about over 20 years ago now on this belief that as the only sector with healing as its mission, healthcare really has an opportunity to use that influence to create a more ecologically sustainable, a more equitable, and more and healthier communities. And we do this work in several different ways. We conduct research, we pilot different projects, and trial these different strategic interventions, and then based on the success of those can provide guidance and resources to really accelerate these best practices through the field, the healthcare field. And we have programs that are focused on a variety of things, from climate and health to safer chemicals, and then the food program, which is the program I work for. So the Healthy Food and Healthcare program has been building a network of hospitals and healthcare partners in the Pacific Northwest since 2005 now, and really trying to work on harnessing not just the expertise, but really the purchasing power and the investment potential of hospitals to develop a healthier food system. So the idea being that if all these hospitals throughout our region, throughout our country can make just incremental purchasing changes and influence the people that pass through the hospitals, then we can have this ripple effect and this amazing change within our food system. And for reference, we partner with about a third of hospitals across the country to do that work. So the Plant Forward Future project specifically is a 3-year project that we have funding from the USDA to implement with these goals that you see up on the screen. So increasing access to regionally produced plant proteins, developing cohorts of both producers and hospitals that will receive technical assistance and mentorship on their own, and then will connect with one another, and then promoting the benefits of a plant-forward diet within the healthcare sector. And why behind the plant protein specifically is each year we measure the progress of our network in different areas of sustainable food system engagement. And the results from last year showed that nearly 80% of our network was supporting local food and farm businesses through their purchasing, obviously at varying levels, but there's a ton of interest in local purchasing there. And nearly 70% is working to reduce meat on their menus and specifically looking for plant-based alternatives to help them do that. So that was really the impetus behind submitting this application and getting this project going. You'll also see up on this slide the logos of all of the partners, Healthcare Without Harm, Ecotrust. We kind of talked about our roles, and the Oregon Department of Agriculture and the Washington State Department of Ag are also key partners on the project team, supporting this work from both sides, the producer side and the hospital side. And then Chef Andre Uribe is also on the project team and will be supporting hospitals specifically and providing culinary demonstrations and helping them with menuing and creative uses for these new products. I think we can go to the next slide. Oh, that's you, Maya.
Yeah, thanks, Amber. So as Amber mentioned, our goal for this project is to develop 2 cohorts, one of producers and one of hospitals. And you can see here listed the hospitals that we are going to be working with. We have Central Washington Hospital based out of Wenatchee, Kaiser Permanente based in Portland, Legacy Salmon Creek in Vancouver, Washington, OHSU in Portland, Legacy Good Samaritan in Portland, and Legacy Meridian Park in Tualatin. And then we are right now in the process of recruiting 7 to 10 farmers, value-added processors that utilize, grow, or process legumes, nuts, and seeds that are interested in selling their products into hospitals. We are giving preference for sustainable or regenerative farmers, women, BIPOC producers, and processors. And each cohort is going to receive technical assistance and support. So Ecotrust is going to really be supporting the producer cohort, and then Healthcare Without Harm will be supporting the hospitals. And the idea is that we will be doing matchmaking between these two cohorts. here is the list of eligible crops for this project. So we're really working at the intersection of high protein, plant-based products and specialty crops, which both have USDA definitions. And so really what this means is that we're working with folks that are growing or utilizing beans, nuts, and seeds. You can see here that there are bolded items on this list, and that represents the top plant proteins by volume that hospitals in this project are currently purchasing. Hospitals also expressed interest in value-added products such as bean burgers, refried beans, bean muffins, falafel mix, and then beans as a retail snack. If you are a value-added producer, as long as the majority, meaning 51% of the product that you are processing is comprised of a legume, nut, or seed, you are eligible for this project. And if you are not currently producing or growing these foods or products, but are interested in participating, we may be able to integrate you or support you in potentially developing a value-added product with another producer in our cohort. Because I know in the registration we had folks that were mushroom growers. I think there was a microgreen grower. And unfortunately, those products aren't eligible, but they could be utilized in a blended plant-based burger, for example. All right, Amber, I'm going to turn it over to you.
Great, thanks. And this slide is perfect. So I wanted to give kind of a high-level overview of the hospital supply chain, just to give an idea of the different avenues that we can get local products into a hospital food service department. So all of the participating hospitals that we're working with in this cohort are self-operated, which means they don't use or contract with a food service management company, if you've heard of those before. So this is really a positive. It makes them much more flexible and easier to work with on pilot projects, since they're self-operated. But either way, these self-operated hospitals still use a set list of vendors and producers, and that really drives the majority of what they can purchase. And they do that by purchasing through a prime or broadline vendor, which you'll see up there on this graphic. And that's the largest distributor or provider of goods into the facilities. And that's like a Cisco or US Foods, if you've heard of those before. And so hospitals select items from these distributors, and then the pricing is set through a negotiation process that's either led by the hospital themselves or led by a group purchasing organization. So that's GPO that you see as the next step up there. And so in exchange for discounted or volume-based pricing, institutions commit to a certain percentage of their goods, which is usually around 80%, and can sound like a barrier that they're having to commit to purchasing that amount from a broadline distributor through their GPO. But there are definitely ways we can work around this. And the 80% is, 80% of their food budget, which is for a mid-sized hospital around $1 to $3 million annually. So 20% that's freed up to purchase local products on their own is a huge amount of money, and is more than we would need to work with for a pilot project. So just want to assure everyone that their hospitals aren't typically so committed that they don't have that wiggle room. Additionally, a lot of facilities can purchase even more than 20% off contract if they're able to meet that 80% with other product categories like paper goods or cleaning supplies. There's a lot of things that they purchase through their group purchasing organizations, not just food. So sometimes it's even more than 20% that could be used on local. And then additionally, one other thing I want to highlight is the products don't have to come in through the broadline distributor. So you don't have to get your product on that product list with a Cisco or US Foods. You'll see there's many other ways that institutions work with local or regional suppliers or purchase directly from farms to source local produce or dairy or specialty supplies. So really wanted to show this and highlight that there's a lot of different avenues to sell into food service. And these are the decision makers that you'll want to know, that we've built relationships with at all these hospitals over the years, and that many of them will be involved in the hospital cohort. So there's food and nutrition services directors, executive chefs are very involved because they do the menuing, purchasers or like procurement managers, retail managers, and clinical nutrition managers or dietetic staff are often involved. And in addition to these, there's also other partners that we build relationships with that can be supportive of changes in the food service settings. And that's like sustainability staff or wellness or community health staff. And sometimes even clinicians like physicians can be really powerful partners in championing changes within food service. You can go to the next slide. Yeah. So these are the different parts of the hospital that companies or producers, food businesses, processors can all sell into. I will say that the decision makers that I talked about before, hospital chefs and buyers and nutrition directors, when they're making purchasing decisions, they're having to balance the tastes and the budgets of three big categories of patrons. So patients are one, and they eat off the patient menu, and that has pretty strict dietary requirements. But then there's also staff and visitors to hospitals that purchase food from these retail settings. So staff tend to be more price sensitive because they can purchase food maybe every day within the hospital. And so they're going to be a little more budget conscious. But visitors are much less price sensitive, and they purchase about half of the meals served in cafeterias. So that's a huge market within these retail settings. So there's everything from cafes and cafeterias, which are probably the most recognizable, to gift shops. C-stores are like convenience stores within hospitals. Hospitals are doing more on-site farmers markets or CSAs that are seasonal ways that you can sell into hospitals. And then vending machines for certain specialty items, and catering is another way to connect. And each one has its own challenges or positives for working with that setting. But I will say in general, the markup in all of the settings is similar to grocery. So hospitals aren't looking to make a profit. They just need to break even in order to keep paying their food service staff, but they're not trying to make a lot of money off of their food service operations.
Amber, can you touch on one of the questions that we got in the registration was minimum purchases? Can you touch on minimum purchases just as it relates to these different environments?
Yeah. I haven't worked with any hospitals that have required a minimum, especially for retail settings that serve, well, I should say that varies from setting to setting. Some hospitals, if they serve something on the patient menu, that has to be able to serve, a minimum number of people, or if they make a change on the patient menu, it has to be made across all of their hospitals. So if they have 4 hospitals and they want to add a local product, you would have to be able to sell enough to meet the needs of all 4 hospitals. Retail food environments for, where staff and visitors go are much more flexible, and I have not seen a minimum. Most hospitals are willing to purchase very small amounts in the beginning to trial products to see if they're what the demand is, and build up from there. There also have been very willing to do like taste tests and trial things in that way. So yeah, no purchasing minimums for that. let's see. So hospital policies and goals. I just wanted to highlight these as kind of the different levers that we can push on to get local products into hospital settings. So many hospitals will have vendor diversity goals and commitments. Legacy and Kaiser specifically do. And so that's something we try to help them meet their goals on. Also, local and sustainable purchasing. Kaiser has a very ambitious goal as a whole system of purchasing 100% local or sustainable food by the year 2025. So in the next 4 years, they're going to be busy, and they're actively switching out other products for local or sustainable products. And so that's a perfect fit for this project. And then all hospitals will have a focus on, health and nutrition, and then meeting their customer demand for healthier products, local products, and plant-based products. So we really just try to, leverage these by presenting products to hospitals that help them meet their goals and really framing it in that way.
All right, I think this is me. So I don't think it'll be surprising to any of you that selling into hospital markets can be challenging. Hospitals are very large and bureaucratic institutions and can be slow to change and less flexible and adaptable as maybe some other market channels that you might be used to selling into. They are often operating in a cost-constrained environment, so tend to be more price sensitive. Of course, like everything else, COVID has impacted hospitals' capacity to engage in systems change work. And so just, as we're navigating this project, really thinking about how we can, utilize their time wisely and just be mindful of all that they have on their plates during COVID and the vaccine rollouts. As Amber pointed out, hospitals are usually working with larger GPOs and distributors that sometimes provide them kickbacks or rebates that can reinforce their relationship or their reliance on them. And so navigating supply chain and distribution can be challenging. And then of course, the sort of elephant in the room is meeting price and volume requirements. And I think Amber just touched on this, is that it really depends on what market channel you're selling into. If you're selling into the retail sort of convenience store at the hospital versus the cafe, that the price and volume needs are going to fluctuate or change. But all of these challenges is, exactly why we're doing this project. This is an incredible opportunity to better connect producers and hospitals to support that relationship building that will kind of enable hospitals to learn about our local food system and also producers so that they can really learn about what it looks like and what it means to sell into hospitals. And Amber mentioned this earlier, but really one of the big goals of this project is to harness the purchasing power of hospitals to, increase their, the sales of local and sustainably grown products. I think, Amber, you've shared with me that, a hospital can be a really important revenue driver for businesses. And so this could be a really great opportunity for you to grow your business. And so, we'll talk a little later on about some of the technical assistance that we'll be offering, but, mindfully walking into these markets, it can be a really great opportunity. And then it has been shared a couple times already, but there's an increased demand for plant-based products, I think, across the board. Of course, food is medicine. And so I think in particular in the healthcare setting, we're seeing an increased demand for that. And I think also this is a great opportunity for producers to get their delicious nutrient-dense food to the hospitals and to people that are already health challenged and that really do need really healthy nutrient-dense food. So we have to be creative, and here are some of the creative solutions that we'll be brainstorming and working through in this project. Obviously producers have an opportunity to aggregate product with other producers to meet some of the minimum purchasing requirements that may be in place in certain market channels in the hospital systems. Working with intermediaries like food hubs or distributors. I know we had a couple food hubs and distributors registered for this webinar. We definitely want to be in touch with you and try and play a matchmaking and value chain coordination role in this project. We're going to be working with the Oregon State University Food Innovation Center on product development. As I mentioned in the beginning of the webinar, hospitals are interested in value-added products like a blended bean burger, for example. And so there'll be an opportunity for producers to engage in some of that product development work. And then exploring different sales channels within the hospital system. And, it may be that starting out in the retail setting at the smaller stores is a great way to dip your toe into the hospital market and plan longer term for what it might look like for you to sell into the cafe environment or cafeteria. Processing and, engaging with co-packers. I think this is something that Ecotrust is really excited to dig in with producers on, and thinking about how, especially if you're a value-added producer, what relationships you have and how you can grow with those relationships, and really identifying potential co-packers that can support your growth. And then, of course, this is going to require thoughtful business planning and understanding your cost of production, your cost of marketing, and really, making trade-off decisions about what it might look like to sell a certain percentage of your product through one market channel and, a certain percentage through maybe a higher margin market channel like a restaurant or farmer's market, and really being able to see holistically what your business looks like if you kind of do the thoughtful business planning around, different sales channels and how much those sales channels contribute to your overall profit margin. So that's definitely something that we'll be digging into with producers. And then Amber, I'm going to pass it over to you to touch on some success stories.
Yeah, and thinking about what to focus on for this section, we have a lot of examples of local purchasing, but at varying levels. Some are with larger local businesses, or large farms or producers. So I wanted to really highlight a project that we're currently working on, connecting small food businesses with hospitals, because I think that's a really great blueprint that we can use when approaching this project. And that project is called the Institutional Purchasing Pathways Project. Healthcare Without Harm and Ecotrust are partnering with Prosper Portland to connect and prepare local businesses, food businesses owned by people of color, to institutional procurement opportunities. And right now we have 5 businesses, a cohort of 5 businesses working specifically with Kaiser, Sunnyside, and Legacy Good Samaritan to tailor their products for retail settings. And so a lot of that is grab and go, developing grab and go products that meet the hospital food service operation needs. And COVID has presented a lot of challenges with this, but I wanted to highlight this project because we're very close to delivering into the hospitals through some different alternative distribution pathways. And I think the learnings that we have from this project will be great examples to use for the Plant Forward Future project. So one, exploring different alternative distribution pathways to get into the hospital, and then the relationship building that has happened through this project has been really amazing. So the food service directors at the hospitals have met individually with each business involved in the cohort and have really spent a lot of time on this process. It's very iterative, going back and forth with the businesses to develop these products. So I think that the relationship building that has happened and kind of the process that we've set up for working with the food service staff will be really beneficial when implementing the Plant Forward Future project. And this is a little more general. I just wanted to talk about some of the opportunities for, working with hospitals in the Pacific Northwest and the survey data that we have from our cohort specifically. So in general, we see, before even starting this project, we saw a lot of potential for local purchasing focused on plant-based products from hospitals. Hospitals in this region tend to have strong commitments to sustainability and climate mitigation efforts. So having a project focused on local foods and plant-based foods and crops that are nitrogen fixing was really key. And just the purchasing potential. So we have, around 60 healthcare partners in the region, and a mid-sized hospital will have a food budget of $1 to $3 million and serve around 3,000 meals a day. So, even if some of that can be shifted, there's great potential there. And then COVID has been tough, but the silver lining with that is we've seen this really renewed interest in local purchasing from hospitals, because small distributors and producers early on in the pandemic really stepped up and were more responsive to hospital needs when some national supply chains broke down. So I know I've heard from a lot of hospital partners that they're more interested in purchasing local and are really seeing a need to shorten their supply chains, localize their purchases, and provide more transparency to their customers too. So there's a lot of potential there. And then we did this survey of the hospitals that will be participating in the cohort and found that over 80% of them are wanting to try regional plant proteins that they don't currently use. And I think there was a question in the chat about regional versus local. That's going to vary hospital to hospital. Some hospitals have a designation where local has to be within 250-mile radius of the hospital. Others, local has to be produced in the state where they're located. So it really varies hospital to hospital. So we're not limiting it. And hospitals, all the hospitals participating also said they have flexibility in their menus to use local ingredients. And, I know from working with executive chefs at the hospitals, a lot of interest from the chefs on using these products because they get to be creative. So they're really excited to use new local products. And then we heard from the hospitals that either all of them are or may be willing, depending on the product and the situation, to enter into a forward contract to provide more stability for producers. So I think that's key. And then all of the hospitals, which obviously we hope to hear yes on this, are ready to engage in ongoing and open dialogue with producers, and are excited about that component of this project.
All right, so now we're going to talk a little bit more deeply about exactly what the hospitals and producers are going to be engaged with and how you can be involved. So this is an overview of the technical assistance and education that's going to be offered for both the hospitals and the producers and processors. So for the hospitals, Healthcare Without Harm is really going to be leading education and TA on working with small food businesses and producers. We're going to have an opportunity to do some farm tours and just getting them on the farm or in the manufacturing facility to just learn more about the businesses. They're going to be supporting hospitals in really understanding the importance of forward contracting, and also, you know, supporting with things like templates and just, you know, language that would enable producers to feel more confident in selling their products to hospitals. Of course, as I mentioned, we're going to be doing some value-added product development in partnership with the Food Innovation Center at OSU. And then Healthcare Without Harm is they're also leading a marketing initiative as a part of this project. And so really, you know, supporting the hospitals in marketing and communicating the benefits of plant-based products. And then Chef Andre is going to be doing some culinary demos and really, you know, encouraging the hospitals to get creative with their menuing and utilizing plant-based products. I think one of the really great things about this project is that in terms of working with hospitals that are in a cost-constrained environment, oftentimes plant-based products are less, they're more affordable than meat, for example. And so just really getting creative with replacing meat in certain recipes and, you know, demonstrating that, you know, they can source a local sustainable meat substitute and also reduce their cost, potentially. For producers and processors, we're going to be doing, as I mentioned, some business planning and market channel analysis. We're going to be connecting with distributors and food hubs to support some supply chain, some value chain and supply chain coordination. Also helping with production planning and product development. And then really, like, the whole reason why we're doing this project is to connect the producers and the hospitals. So the connections and networking, Ecotrust is going to be supporting producers and doing that relationship building. And also we'll be providing opportunities for the producers in the cohort to get to know each other and learn from each other. So this is a timeline for our project. So we are recruiting producers and processors until June. June 1st is our deadline. Healthcare Without Harm during this time is going to be working with hospitals on understanding more deeply what their needs are for value-added products. And then Amber is going to be leaving on maternity leave. And so Ecotrust will be working through the summer on value-added product development with producers and with the Food Innovation Center. And when Amber gets back from maternity leave and after the busy farming season, we're going to kick off the project with both cohorts coming together in the fall of 2021. And then Ecotrust is going to be providing technical assistance to producers, you know, pretty much starting Q3 all the way until, I believe, April of 2022. So that would look like monthly meetings with Ecotrust to support you in, you know, decision making and business planning and understanding your costing. So those monthly meetings will happen with Ecotrust starting Q3. And I think there's a lot of, you know, there's flexibility here in terms of how often producers are needing technical assistance. There might be a more sophisticated business that doesn't need as much TA, or, you know, in terms of when technical assistance happens, if you have a really busy season, we can kind of time TA based on your availability. And then starting in Q4 with the project kickoff, we're going to be engaging, you know, the hospital buyers and the producers and meeting one-on-one and then through events pending COVID. Every year, Ecotrust and Healthcare Without Harm, we do an event in Portland called Local Link. It hasn't happened due to COVID last year, but we are thinking about ways that we can connect producers and buyers through events, and also farm tours is a possibility as well. So here's just briefly how you can be involved. So if you are a grower, a processor, a distributor, or a food hub, we encourage you to fill out our interest form. We'll be sending that out with the recording to all of the registered participants. We will be in touch with you. Distributors and food hubs are not, eligible for the technical assistance in this project, but we want to be in touch with you just so that we can better play a matchmaking role if producers are interested in working with like Puget Sound Food Hub, for example. The deadline to submit is June 1st, and then we'll be having one-on-one meetings with growers and processors to decide who's going to be our cohort of 7 to 10 businesses. And then I know we have a lot of nonprofit organizations or folks that work in food systems change on the call today. And so I just wanted to also share, if you're interested in farm to hospital work, you can always reach out to Amber from Healthcare Without Harm to get more involved in some of the work that they're doing. If you work with producers in your region, you could share the interest form with producers and encourage them to apply to participate. And then there's a Healthcare Without Harm has a Plant Forward Future website that you can go to that has more details on the project. And I don't know if we've mentioned this, but this is a national project. The Pacific Northwest is one of the regions, but Healthcare Without Harm is doing this project across the US. And so the project page kind of talks about the initiative from a more higher level. And it's a great way to just stay in touch. And I believe there might be a newsletter sign up on the website as well. So we have about 15 minutes for Q&A, and I know we've been trying to answer some questions as they've come in, but I'm wondering, Jolie, if you are tracking and could maybe...
Yeah. Hi, sorry, I had to switch headphones for a moment. Yes, so I've been trying to answer some questions, but I think it might be worth just revisiting some of these so that everybody knows. One of the questions that Daniela put out was, is there a list of contacts for reaching out to people in charge of purchasing as part of this effort? I had answered that the cohort of producers and value-added processors will get opportunities to connect virtually with hospitals and develop direct relationships with staff in charge of purchasing. But does that sums it up, or is there anything else that I'm missing? Amber or Maya?
Yeah, that sums it up. Thank you.
Yeah, and let's see. Someone asked, will there be opportunities to expand this to other health-forward plant-based products that are not necessarily high protein? And I think that was the question beyond the solid foods regarding the beverage. I think it was Alyssa, is that right? And Alyssa, if you're with us, if you want unmute and maybe further develop your question.
Hi. This is an amazing program, so thank you for sharing it with all of us. My question was, yeah, for beverage products particularly, is there a timeline that hospitals might be looking to launch a program for that, or are they really just focused on solid foods at this point?
Do you want to take that, Amber?
Sure. Yeah, I mean, hospitals are always purchasing different products that don't meet this high protein specialty crop definition that we have for this project. But for our work on this project, we're just really focusing in on that. So they would have to, the product would have to contain over 51% beans, legumes, nuts, or seeds. But you know, there's other projects that we have going in the Pacific Northwest. So if you want to connect with me, there could be other opportunities with one of those projects.
Okay, that would be great. Do you mind putting your email in the chat?
No, not at all.
Okay, thank you.
I think Maya, too, we have a slide with emails and our contact. Yeah, that way it's easier for folks. Okay, so another question we got was, if you do not become a producer in the initial cohort, Are there opportunities that we could create for future farmers, or is this a network to support the 7 to 10 cohort members only?
I think that's a great question. I think at this time, we're focused mostly on producers who are producing products or interested in producing products. But I definitely would love to chat more about what that would look like in terms of supporting future farmers. I think oftentimes farmers begin their farming venture selling direct to consumer through farmers markets or CSA programs, but I think, it's definitely a great opportunity to engage them in selling, products through hospital markets or other market channels. So yeah, I would say reach out to me and let's talk.
Okay. I see someone has a raised hand. We do have a couple questions in the chat, so maybe we can finish those and then we can go to the person who has the raised hand. Let's see. Okay, so there was a question regarding what are your findings regarding hospitals' willingness to use processed products? There's a Seattle-based company that makes plant-based nuggets, patties, and tenders, all non-GMO, but not whole foods, of course. That was the question. and if the, yeah, go ahead, Amber.
So hospitals are interested in processed meat substitutes. I think the more minimally processed, the better. But for this particular project, it would just have to be 51% would have to meet the specialty crop high protein definition that Maya talked about at the beginning. And so I don't know if there's soy, but soy is not does not meet the specialty crop guidelines. So that would be one. It'd have to be the beans, nuts, seeds, or legumes that were listed on, I think it was like the second or third slide. So that would be the only thing.
Thanks, Amber. There was also a direct question that came my way regarding someone has a client that does dehydrated backpacking food and wondering if I think they do include some lentils and nuts and some mixed prepped food items kind of ready to eat. Would those be eligible for this project, or would hospitals be interested?
I would say yes, they would be eligible, but Amber, correct me if I'm wrong.
Yeah, as long as they had over half the product where met those product definitions, I think so. Yeah, and I mean, the interest, it's an interesting product. So I have not talked to hospitals about it before, but I would be curious to see probably in the retail setting as a, a snack item.
Yeah.
But yeah.
Excellent. And what is the target or goal to start having the hospitals start buying from the producers and processors?
Yeah, I think, we'll be facilitating connections between the two cohorts early fall. And so we don't have, a set deadline, but soon, within that first year of the project would be ideal. And obviously the sooner the better. So we'd be looking to do it as close to that launch as possible.
Okay, we're almost done with the chat questions. There's a question from Daniela from Adelante Mujeres. Can we co-apply with farmers? She's thinking specifically of farmers in her network that don't speak or write English as a support agency / nonprofit. Can it be a collaborative venture?
Hey, Daniela, yes, I think that's a great idea and I'd love to work with you on that.
Excellent. And then there's a question that came up regarding soybeans. Would they be considered edamame, and would they be considered a high protein wheat meat products? And I believe soybeans are not eligible, but correct me if I'm wrong. I think, Amber, you just mentioned that a little earlier. Yeah, okay. And then let's see. One more question in the chat, and then we'll go to the raised hand. It's kind of a long question. Do you know whether the 100% local goal for Kaiser is company-wide or just the system that is part of your cohort? For example, is the Seattle Kaiser group also doing this, and how can we also connect with them? Or in general, is there a resource out there to connect with hospital systems outside of this project? With this group self-distributes, so getting to the systems in the project are far enough to be challenging without first establishing a relationship with a distribution company.
Yeah, and I started answering that and pressed enter and didn't finish. No, so it's good. Thank you for bringing that up again. So yes, Kaiser's goal of 100% local and sustainable, local or sustainable food purchasing is system-wide. So that's all their hospitals, anywhere, California, anywhere they have a system. I am most closely connected to the Kaiser hospitals in Oregon. So I don't have a sense of the Seattle one, but if you want to connect with me offline, please feel free to email and we can talk through that.
Thanks, Amber. And I just saw a comment in the chat, just checking in that we'll share contact info. Yes, we will share out the recording, the interest form, and our 3 emails, as well as like other members of our team. Thanks, Amy, for clarifying that edamame is eligible, but soybeans are not. Okay, so I think we can go to the person who has a raised hand, and I'm sorry, I might be mispronouncing your name. Lakea Kaufman, do you want to unmute and ask your question?
Sure, yeah, thank you. I'm just curious, what if you folks have discussed like infrastructure and storage needs with hospitals, specifically, like I have a farmer that I've been talking to who we've been trying to do some mental math about like how many acres of dry beans they would need to grow in order to meet like their costs, basically to just break even on their labor and equipment. One of the farm, there are a couple, but one of them is paraplegic, and so they have to do all of their work from a tractor to just simplify their farming. But so right now they're doing grass seed, and they've told me like, well, we would convert and do dry beans, but we would need to do a certain amount of acreage in order for it to make financial sense. And we have those farmers in particular have no way to store that amount of beans. And I'm not sure. Yeah, I guess I'm wondering if you've talked to hospitals about what their storage or infrastructure capacities are for these products.
Amber, do you want to take that?
Yeah, no, not specifically. I mean, it varies from hospital to hospital, but that will definitely be something that will be, addressing and troubleshooting individually with each hospital, their storage capacity, especially if they're switching from like a canned product to a dried product or something that they haven't typically carried before. Sorry, I don't have more detail on that right now because I think it really is going to depend on the facility.
Yeah, Elliot, thanks for chiming in the chat. I was just going to say too that feel free to shoot me an email and we can brainstorm ideas around storage and what the storage needs are. I'm not sure where this farmer is located, but I'd be happy to chat more in depth with you offline and support this farmer in finding a storage solution.
Thanks, Maya. Let's go to Riva and then Daniela.
Hi. I really appreciate you guys doing all this. My experience has been that I created a product with FIC. It took us 5 years to develop the first solid food for people who can't swallow or can't chew effectively, and it's all plant-based. It fits the chickpea rule. But it's made with aquafaba, which I think is also helpful. But I came at it from a different way because I'm a clinician. So I went to the clinicians with education about malnutrition and how this fits the changed behaviors and eating preferences when people can't swallow effectively. And then we're doing studies and we've published on the advantages. So as I came through with like the rah-rah from the speech language pathologists, it reached like this impasse because the food managers look at the budget, right? And then they're looking at it through their lens, and then the clinicians are looking at it through their lens. But I couldn't seem to get them together, you know, and I really wonder with a product like mine that isn't really for the cafeteria, or you know, it's really for the nurse's station, and it's all shelf stable, so when someone doesn't eat their meal, they can have something at midnight that satisfies their needs. So I just wonder if, you know, you have educational tools in place or in mind for this cohort where you can bring not the decision makers from the clinical staff together with the food and beverage so that they start to communicate more on these issues, and, you know, kind of more holistic approach to it.
Yeah, that's a great point, Riva. I'm a former clinical dietitian, so can understand how siloed things can get. It's pretty amazing how you can work on food, but if you're, you know, a clinician versus someone in the food service department, you might not interact that much. And it's, I mean, I just will say generally, it's something that we work on, is like breaking down silos within hospital settings. So, you know, I listed that list of decision makers that we're really focused on for this project, but that there's clinicians and wellness staff and community health and even sustainability staff are all important and involving in this process. So we will be exploring with the cohort different education needs and tailoring and developing either materials or webinars or whatever they need to really address that. So, you know, I can't say that we will definitely have a session on connecting with clinicians, but it is something that we, you know, encourage with our hospital partners, is to connect more broadly across their institutions. But yeah, I'd love to connect and learn more about your product, because it's really, it's an interesting one. And I do know some hospitals looking for different products for dysphagia diets. So there could be a potential fit there.
I think that if we could develop research out of this group where we show quality of life improvement and more food engagement because the food choices are better, then that can make those decision makers realize that our food might be a premium and the price might be a little bit higher, even if it is plant-based. But if it can reduce malnutrition, you know, like you're looking at a bigger financial burden that we can engage and reduce. Do you know what I mean? For a hospital. So
yes, yeah,
I would love to talk to you more about that.
Yeah, that would be great. Yeah, with all of these things, like the hospital's paying the cost somewhere down the road if they're not serving healthier, more nutritious food up front, then they're paying or treating the impacts of unhealthy diets further down the road. So yeah, great point. Thanks.
I just want to bring attention to our time. It's 11:01. There's 2 hands raised. Amber, Maya, do you have a couple minutes?
Yeah, I can stay on for a couple minutes.
Okay. So Daniela, you had your hand raised first. Can you unmute and ask your question?
Yes, I can. Thank you, Jolie and Maya and Amber, for making time for extra questions. This will be just really quick, and I'm sure it'll be touched in the process, but so bulk prices for these types of crops tend to be on the cheaper side. And the cost to produce them locally can sometimes be on the higher side. So are the hospitals willing to pay the higher price? Is it a set price for the crops that you're working with, or will it be based on each individual producer? Can you touch a little bit about how that will work? And no worries if this is the rabbit hole, we can talk about it on another time too.
No, thanks, Danielle. That is the question in a lot of ways. I think some of the hospitals, I think over half of the hospitals that we're working with in the cohort have expressed that they're able to increase their prices for local or sustainable purchasing. So I think, the extent to which they're able to increase their prices is probably going to vary. But this is exactly the meat of what we're trying to address in this project, and really helping to educate hospitals in, understanding the nuances of growing and producing these products. And so I think there'll be, a lot of conversations about this at many points in the project. And our hope is that hospitals are able to increase their prices for local or sustainable purchasing. And many of them indicated that they are able to. So I think it'll just be trying to understand what that looks like, and working with producers and advocating for producers, to get a price that doesn't, break the farm or have them lose money. So thanks for that question.
Thanks, Maya. All right, and we will close the last question with Erin.
Thank you so much for all this valuable information. We're kind of coming at it from a different direction with Bambusa. We are a local kitchen, basically. We've got a flexible staff, 700 square foot kitchen, refrigerator space, and storage. And we would be looking to enter the cohort as sort of like working with partnerships with growers to produce some of the products. Is that something that we would need to relationship build and like find a farm to partner with, or find a crop to partner with, or something like that before we would express interest? Or is that something you guys are looking for a component as part of the cohort to sort of take things from farm to product? Or not at all?
Yeah, that's a great question. I think I would definitely love to chat more with you offline and just learn more. I think you could certainly fill out the interest form, and we would follow up with you and maybe have a deeper conversation about what a partnership might look like, and if, engaging through the cohort is the best role for you, or if there's, a more appropriate role that you might play in the project. But yeah, it sounds really interesting, and I'd love to chat more.
Okay, great. Thank you.
Yeah.
All right. I think those are all the questions.
Thanks, Jolie. Yeah, and thanks everybody, Amber, for joining today. And please reach out to us. Our emails are on the screen here, and I did post them in the chat. I will be, or Jolie will be, somebody will be sending out the recording with our contact information and then the link to submit interest. Always feel free to reach out to us, and just really thank you all for your time. Have a great day. Thanks guys. Take care.